Hey everyone, Professor Davis here, and today we're going to talk about the nervous system, diseases, and disorders. Now, just like any other previous video that we've had here, we're going to do a brief overview of anatomy and physiology first, before we dive into the diseases and disorders. So when we look at the anatomy and physiology of the nervous system, you need to remember that there are a couple components or structures, one being the brain. We also have the spinal cord and your nerves. Now, the brain and spinal cord both make up the central nervous system, the center part, and the nerves are going to be making up the peripheral nervous system kind of off to the side. Now, with the peripheral nervous system, it is subdivided into some different groups. When we look at the autonomic system, it is the one that is going to automatically occur without you consciously being aware. Whereas the somatic nervous system is going to be more for your skeletal muscles and your voluntary control. Also, the nerves that are part of this peripheral nervous system are going to be composed of cranial nerves, which are located in your head, and spinal nerves, which go down the spinal cord. Now, these nerves are going to carry certain information. Some of them are going to carry sensory information. Some are going to carry motor information. And the nerves that are found in your central nervous system are going to be where they integrate the information from your sensory to your motor. So if we take a look at a few of these pictures here, we do have the structure of the brain. Remember, the brain, the cerebrum, top part of the brain, is composed of lobes that we include the frontal lobe, right here, the parietal lobe, the temporal lobe, and the occipital lobe. Deeper to these lobes, you're going to find the diencephalon, which includes the thalamus, hypothalamus, and epithalamus. And the thalamus specifically is that relay station that brings information from your peripheral nervous system and it integrates it into your brain. We then have the cerebellum, which is below the cerebrum, and this is the second largest part of the brain, and it's going to help control posture and helping you also with integrating movements and being very patterned with them. So when you walk across the room, not having to worry too much about that coordination. We then find that you have the brainstem. The brainstem is composed of three parts: the midbrain, the pons, and the medulla. The medulla is the lowest part that then connects to the spinal cord. The spinal cord then travels down the whole spinal canal, and off of that spinal cord we will find different spinal nerves. These spinal nerves are based on where they exit from the spinal column. So if they exit from the cervical area, they're represented with a C. The T was the thoracic area. The L is the lumbar area, and so on. And so this gives you an idea. Now, cranial nerves are going to come from the head. That's the name being cranial nerves. Now, when we look at these spinal nerves, they do service certain parts of the body, and you can see them labeled here. These are called dermatomes. These dermatomes are going to be areas like if you're having sensation issues there or motor issues there, then that's the nerve that could potentially be the culprit. So now let's take a little bit closer look at those cranial nerves, because when we talk specifically about the cranial nerves, as well as a lot of the other idea of the spinal nerves, they're going to be part of the neurological exam that is done as diagnostic tests. Now, the neurological exam is done no matter when you go to the doctor. It's composed of a number of things, which we'll talk a little more when we get to that diagnostic test. So when we look at the cranial nerves, they are going to be numbered with Roman numerals. There are 12 pairs of them. So you have 12 on the right, 12 on the left. These guys are going to have either sensory components, motor components, or they may be mixed nerves where they have both sensory and motor. So cranial nerve number 1 is olfactory, and so that's for smell. We then see optic nerve is cranial nerve 2. Then you look at cranial nerve 3, 4, and 6. We'll come back to 5 in just a second. But 3, 4, and 6, which is the oculomotor, trochlear, and abducens, they all help with movement of the eyeball. So moving your eye and allowing you to be able to roll your eyes is due to these 3 cranial nerves. Cranial nerve 5 is known as the trigeminal nerve, and it has 3 branches. That's where the tri comes from. And the 3 branches service your whole face. There's a branch that goes to your forehead, one that goes to the maxillary region, and one that goes to your mandible. This trigeminal nerve is going to transmit pain and temperature as well as touch from the face and the mouth. And the lower branch, the mandibular branch, is going to have a motor component that's going to help with chewing. Cranial nerve 7 is going to be the facial nerve. It's going to help with the movement of the face as well as secretion of saliva, and it's going to also help with taste. Cranial nerve 8 is the auditory nerve, also known as the cochlear vestibular nerve. When we look at the auditory nerve, it's going to help with hearing and balance. The glossopharyngeal nerve is going to help with swallowing. It also deals with the secretion of saliva. It helps with taste, and it's going to give you sensations from your mouth and your throat. We then have cranial nerve 10, which is the vagus nerve. The vagus nerve is going to give us sensations and movements of the pharynx or the throat. They're also going to travel a little bit further down into the chest cavity and the gastrointestinal system. So the vagus nerve is known as the wanderer. It wanders out of the cranial region, unlike most of the other cranial nerves. Then you have cranial nerve 11, which is the accessory. The accessory is going to be for movement of your head, so moving from side to side, up and down, and also your shoulders, this whole idea of shrugging. And the hypoglossal is going to be the movement of your tongue. So there's going to be part of the neurological exam that actually tests each of these to make sure that these cranial nerves are working. So guys, some of the common signs and symptoms of nervous system disorders or diseases could be included here with things like headaches, also nausea and vomiting. Sometimes the pain or the discomfort can be so great in the brain that it actually disrupts the digestive system and causes nausea and vomiting. We also see that there can be weakness in the muscles, that those muscles are that those nerves are supposed to be talking to. You can have mood swings as well. And if infection is present, there could also be fever. Some other symptoms that are specific to the central nervous system, because a lot of those others you can have with other disorders. But with the central nervous system, you might have stiffness in the neck, your back, and even your extremities. You may also have an inability to move any part of your body, or you could end up having seizures or convulsions that take place, as well as paralysis, where you're paralyzed. These first four are part of the neurological exam that is actually looking at the motor function of your nervous system. When we go to the next set where we talk about visual difficulties, inability to speak, paralysis, and this is like paralysis of certain muscles that deal a lot with senses. These are going to be more of the sensory functions that they would be testing. Some other specific symptoms include extreme or prolonged drowsiness, stupor or unconsciousness, amnesia, or extreme forgetfulness. And these would all be tested for by doing the neurological test for your cognition as well as your mental alertness. And so if we go back to this idea of a neurological exam, this is why they would ask you certain questions when you come into the doctor, like what's the date, who's the president, different things like that. What's a big sporting thing or something that's been in the news lately. They want to see if you have some of that alertness and that awareness. They will also test your sensations. They may have you look at certain things or listen for things or have different ways that they test your touch. They will also then do some motor functions where they'll have you actually like pull and resist away or push with your legs, maybe even get up and walk or close your eyes and do balance. All those are going to be part of that neurological assessment where we're going to test motor, sensory, and your cognitive ability. So some of these diagnostic tests are going to be things like cerebral spinal fluid testing. This is going to be done through a lumbar puncture. And when we take some of this fluid, we can test it to see if there's an active infection. This infection could be fungal, it could be bacterial, it could be viral, but something is happening in that cerebral spinal fluid. With that lumbar puncture, we can also measure your intracranial pressure. We can measure the amount of pressure that's in the brain case as well as in the spinal canal. Because guys, the central nervous system tissue, the brain and spinal cord are actually very fragile tissues. And so extra pressure on them could cause some very bad damage. We also see there could be x-rays of the skull and vertebral column. This is going to look at the bony structures. They could do a malleogram, and this is going to be where they test the muscles. When we look at the muscles, guys, muscles have to get their information from nerves. And so if there's a nerve issue, the muscle may not contract. And it could be that there could be a muscle issue and the nerve is still sending the signal, but they would need to test that out to see. Angiograms can be done in these areas to evaluate blood flow to the brain or the spinal cord. Electroencephalography or an EEG is what we're looking at as brain waves. So we could be testing your brain waves to see that you have proper brain activity. And then, of course, if we want to look more at the soft tissue, there could be a series of different types of CTs and MRIs that could be done. So let's go into the first group that we want to talk about here, which is the infectious diseases. So when we look at infectious diseases, they could be caused by a number of things. They could be caused by bacterial infections, viral infections, fungal infections, but they are going to be caused by something that invades the tissue here. We do see that these are going to actually be more common in the younger people than older, due to them being exposed and their immune system not being very advanced or developed enough in order to fight these infections off well. So the first one we want to look at is called encephalitis. Encephalitis is actually the inflammation of the brain tissue itself. This can be caused by bacteria or by different viruses, and a lot of times when it's a virus issue, it's due to complications of some childhood diseases that include chickenpox and mumps. Now, we have vaccines that can help prevent patients from even getting chickenpox and mumps, but there is a complication that could occur if this virus does break out. So symptoms when we look at encephalitis, the patient will have headache, elevated temperature due to fighting the infection, a stiff neck and back area. They'll be lethargic, just kind of tired and run down. They'll have mental confusion, and ultimately it could progress where the patient goes into a coma. Now, how do we diagnose this? One of the best ways is through the spinal tap and getting some of the cerebral spinal fluid. This lets us look at it and evaluate what is actually causing the infection. This will in turn help us determine what treatment needs to be done. If it's bacterial, we would then treat with antibiotics. If it's viral, however, we do not treat with antibiotics. So treatment is supportive. It's going to help the body be able to fight the infection, and antiviral medications may be effective in helping the body fight. Okay, ultimately, the body and the immune system has to take care of the invader when we talk about encephalitis. Now, the next one is meningitis. Meningitis is inflammation of the meninges or coverings of the brain and spinal cord. When we look at this, it's not the actual brain tissue. There are special coverings around the brain and the spinal cord called the meninges. This is when these guys get inflamed. Again, the cause could be anything from bacteria, virus, fungus. There could even be toxins like lead poisoning or arsenic that could cause meningitis to occur. And this again is anything that causes inflammation to happen. Now, symptoms include a high fever, severe headaches. They will have photophobia, which means that they don't like light. They can't tolerate light really well. Stiffness and resistance in the neck. And a lot of times we call this nuchal rigidity. There's a lot of rigidity in the neck muscles and the neck itself. Drowsiness, stupor, and seizures may develop. And this is going to be more in progressed cases of meningitis. And then, of course, coma. And these last two with the drowsiness, stupor, seizures, and coma, of course, are going to be more advanced cases of meningitis. Diagnosis is going to be a lumbar puncture. And again, this is to find the causative agent so that we can give proper treatment. Treatment includes antibiotics when we're talking about bacterial infections. However, if it's any kind of infection or any kind of fever present, we would use antipyretics. If seizures are taking place, we would do anticonvulsants. And having the patient in a dark and quiet environment can actually help them, especially with the headache symptom that they will have. One thing about meningitis is if it is left untreated, it can be fatal, especially when we find it in infants, children, and the elderly. The next group we want to look at, or the next infection, is poliomyelitis. Poliomyelitis is also just known as polio. This is due to a viral infection that affects your brain and your spinal cord. The cause here of poliomyelitis is a virus that is spread through the oral pharyngeal secretions, okay, so from the mouth and throat. They then can be found in infected feces, and so we call this the oral fecal route because it can shed in the feces because it travels through the digestive system, and if we don't wash our hands properly, we go prepare food or we have something that gets on something that we put in our mouth. That's why we call it the oral fecal route. Now, this has almost been eliminated in the United States because of the vaccine that's given for polio. In other countries where vaccines for this particular disease are not given, we see that polio is very much there. And if we stop vaccinating children for polio, it will reemerge and come back, okay? It will be seen in our country again. Now, symptoms for somebody who has polio are going to be muscle weakness, We also see that they can have a neck stiffness that takes place, nausea and vomiting. Muscle atrophy can happen because the muscles are so weak that they're not being used that they start to shrink. They can even become paralyzed in some cases, okay? And this is a big problem when we're talking about the skeletal muscles that help you breathe. If the skeletal muscles like the diaphragm or the intercostals, the ones in between your ribs, are going to be paralyzed due to this, it could cause the patient to not be able to breathe, and they would need to be put on a ventilator. Diagnosis: virus culture from the throat, feces, and or spinal fluid is going to be the best way to diagnose poliomyelitis. We also see supportive treatments are going to be analgesics, so painkillers, bed rest during the acute phase of infection. Long-term physical therapy and braces might be needed because there could be long-term effects of the muscles and nerve damage down, especially to the lumbar and the leg areas. We also see if the respiratory system is involved, mechanical ventilation may also be required or needed. The best precaution for polio, like I said earlier, is the vaccination. The next one we want to talk about with the infectious diseases is rabies. Rabies is often a fatal encephalomyelitis, and this right here is a really big deal because it is caused by a virus, but it's primarily going to affect animals like dogs, cats, raccoons, squirrels, foxes, skunks. They are going to have rabies more often. However, it can easily be transmitted to a human through a bite from an infected animal. So it's really important to be careful around animals that are wild, or if you have a cat or dog that is showing symptoms of rabies. Now, symptoms include things like fever, pain, paralysis, so they start to have weakness, and even a type of where their muscles are paralyzed, they can't function. They can have convulsions, and they can also develop a type of rage, an uncontrolled rage that can take place. Now, what's crazy about this is the incubation period after transmission could be anywhere between 1 to 3 months, where you do not see any symptoms from the individual until up to maybe sometimes 3 months after they were bitten by an infected animal. Now, some other symptoms that do include spasms and paralysis of the muscles for swallowing. This is in a more advanced case of rabies, and this causes an issue because it causes throat spasms, especially when water is involved. A patient who has rabies actually develops a hydrophobia. They are scared of water, and if they see water or water has been brought to them to drink, they start to have spasms in their throat, and they panic, and they want to get away from the water because they're looking at the water as being dangerous. They have an inability to swallow, and this causes them to develop a drooly, frothy type of saliva because they are not able to swallow. Now, treatment. Immediate washing of an area with soap and water when you are bitten needs to be done, and an anti-rabies injection may need to take place because there's no cure for rabies, and so we've got to get it taken care of before it progresses. Otherwise, the patient will die from rabies. The last infectious disease I want to talk to you about is shingles. Shingles is a viral disease which is caused by herpes zoster. Now, herpes zoster is the virus that causes chickenpox. When we look at this, chickenpox is seen as a childhood disease, and it does manifest on the skin. Shingles, however, is where this chickenpox virus has been sitting in your cerebral spinal fluid. And it picks a nerve, whatever nerve it's hanging out next to, and then it breaks out along that nerve. You can see how there's a pattern here where it breaks out along that nerve or dermatome, which we saw before in that picture. This is a lot more painful because it's not just manifesting on the skin, it's emerging from the deep nerve onto the skin. And so shingles is a lot more painful than chickenpox versus being itchy, like chickenpox is more itchy. Now, there will be an itch with this, but it is itchy, painful red rash that develops with small vesicles, and they are located on the sensory nerve path. Symptoms can last 10 days to several weeks when we talk about shingles. Diagnosis is made based on the appearance of the lesions, and so they're able to see that what the lesions are and be able to tell very quickly that it is shingles. However, they could also do a viral culture to confirm it. So when we look at treatment of shingles is going to deal with your symptoms. Because there is no cure, it is a virus, there's no cure to it. Treatment will be symptomatic. Okay, if it's pain, we want to give you analgesics, painkillers. If you are having fevers, we want to do antipyretics. If it's itchy, we want to give you something that helps stop the itch. Antivirals could be used to also help address some of these symptoms. There is a vaccine that is available for shingles. It is recommended by the CDC for adults who are over 60. If you're under 60, they're not going to recommend that you get this shot. Now, the issue with this is that shingles, because it's already present and it's sitting there, it will reemerge and cause issues like this in the picture when the patient is stressed or their immune system is compromised by some other illness. So anytime your immune system's compromised, these shingles could ultimately flare up. All right, so this finishes up part 1 of the nervous system diseases and disorders. In part 2, we'll focus a little more on strokes, or what we call CVAs. We'll also look at some issues like headaches, Parkinson's disease, and some things like that, as well as Alzheimer's. If you have any questions, please don't be afraid to ask.